American-born Bob Bevins has cancer of the mouth. Tomorrow, he will undergo one of the most complex surgeries provided by St. James's Hospital. Part of his mouth and jaw will be removed and then rebuilt using bone from his leg. Bob's speech and swallow could be altered permanently.
I had this little place in my mouth like an ulcer, and I went to the doctor and he looked at it and he said, God, I don't know. I don't even know what I'm looking at. So I went to my local dentist, and as soon as he seen it, he said, oh boy, he said, no, this is no good. So he sent me further afield then.
Bob and his daughter are attending a last consultation with his two surgeons the day before the operation. Paul Lennon will remove the tumour. Surgeon Conor Barry will conduct the second part of the surgery, reconstructing Bob's jaw using bone from his leg.
We have a special scanning protocol for these patients, and based on the CT scans we get, the raw data from the scans is uploaded to a website, and this company is based in Belgium. We then have this planning session, and they use the data that I've uploaded to digitally reconstruct both the jaws, but also where I'm going to take the graft from.
Say R for me.
R for you.
3 weeks ago, Bob Bevins had a complex 10-hour surgery to remove a tumour from the floor of his mouth. Surgeon Conor Barry reconstructed his lower jaw with bone from his leg.
So this is the leg bone, or the fibula bone, that we've transferred from the leg up to the jaw. It's a fairly short section of bone. I wanted to position it a little bit above the lower border so that we can, at a later stage, put in some dental implants and give him some more teeth. Bob's lost the nerve on this side. The patients cope very well. They adapt very well to having numbness on one side of their lip and chin, but not both. The morbidity is greatly increased. So that's why we've bent the plate downwards and following the contour of the jaw towards the lower border to avoid that nerve.
The operation to remove the tumour and rebuild the jawbone has been a success. However, Bob's speech and swallow function also need to be assessed. Surgeon Conor Barry is joined by surgeon Paul Lennon.
It's maintained the mobility of the tongue. Stick your tongue out, Bob. So Bob has excellent tongue mobility over to here and over to here. And you can tell that anyway by the fact that he has really good speech and swallow. In fact, I think in a few weeks or a couple of months, nobody will even know you've had surgery.
I doubt it. I'd be very surprised.
Yeah. Good stuff.
Oh, no, I'm very quite happy with both of the work you